So what about the genetics of pancreas cancer? We know that at least 10%, and that's probably a conservative figure, for this disease is associated with a genetic predisposition. And in some, there are a number of single gene mutations that are well described. So for example, hereditary breast and ovary cancer syndrome via BRCA1 and BRCA2 contributes to the risk of this disease. The Lynch genes, also associated with stomach, endometrial, and urothelial malignancies, account for a small proportion of the incidence of this malignancy. And then there is a group of individuals where we see 2 and sometimes 3 relatives in a family where we do not know what the genetic link is, but presumably there is a genetic link that just has not been identified yet for these individuals. And that's actually the biggest group that have a potential familial predisposition to this cancer. So this is an analysis from 1,000 patients who underwent initially somatic profiling in pancreas cancer. And then this was an evaluation of the paired germline genetic analysis that was done across a variety of cancers at Memorial Sloan Kettering. And in this first pass of 176 patients with pancreas adenocarcinoma, we identified that about 16% had a germline genetic finding, with BRCA1, BRCA2 being most common, CDKN2A, that's germline mutation next, and then PALB2, ATM, and a number of other lower frequency events. We did a further deeper analysis on this, and of importance, about half of these germline mutations occur in genes that are associated with DNA damage repair. And the potential implication for that for the individual affected is there may be therapeutic opportunities that can be aligned with these genes. And we'll review this in the section on therapeutics and emerging advances in later stage disease. So what to do for high-risk families? These are families where a number of individuals have a confirmed diagnosis of pancreas adenocarcinoma. So there's a few healthy lifestyle recommendations that are made. So for example, we counsel people not to smoke, to have a healthy, balanced diet, to remain as active as possible. And for healthy family members of these families where there are several individuals that have been diagnosed with pancreas adenocarcinoma, we recommend enrollment on screening registries and potential consideration of trials. And these family members may also benefit from counseling by genetics counselors in terms of evaluating their individual risk of this disease. So this is a very active area. And to sum up here with regard to the genetics and epidemiology for pancreas cancer, we know a lot about the development of this disease. Identifying individuals at high risk is a challenge, although there are subsets of individuals that may be identified. Healthy lifestyle recommendations are important for families where we see multiple members with pancreas adenocarcinoma. And for each individual diagnosed with this disease, we recommend now routine genetic testing, both on the blood in terms of the family germline and in terms of the tumor.